Hello everyone, in this video we are going to learn about the drug proving. It is mentioned in the aphorism 105 to 145 in the Organ of Medicine. This video deals with definition, objects, prerequisition, prover, preparation, dose, administration, recording of symptoms and at last precautions that should be taken while drug proving. First comes the definition. The definition is given in the aphorism number 105, that is, drug proving is the process of acquiring a knowledge of instruments intended for the cure of natural diseases. In simple terms, it is the process by which we can know the pathogenic power of a medicine on a healthy person. Next comes objects. Objects of drug proving includes to know the pathogenic effect, to observe and record alterations of normal sensation by production of subjective symptoms, to observe and note deviations in the appearance of the surface, changes in tissues, organs and in physiological functions, to reduce the characteristics of the drug as they manifest in the disease state. Next comes prerequisition of drug proving, that are essentials of drug proving. They include drug, prover, environment. The drug should be of genuine quality, that is unadulterated form. Prover must be perfectly healthy. Environment. The drug proving should be done in the normal surroundings of a prover. First we have to select the prover. It can be done on either animal or human. In case of animal proving, there are disadvantages and advantages. Subjective and mental symptoms cannot be studied properly. Modalities and finer sensations are lacking to make a symptom complete. Effects are different. Proper individualization of the knowledge of drug is never possible on animal provings. Susceptibility and idiosyncrasy is difficult. These are the disadvantages of animal proving. While coming to the advantages of animal proving, proved in any quantity for any length of time, we may go to ultimate pathology and there to lose the prover. Provings with unknown substances may give a first-hand information with regard to its action on living organism to assess the physiological action of the drug. Next comes human proving. In case of human proving, it can be done either on sick person or healthy person. In case of sick person, there are disadvantages. Sick person includes symptoms of medicine and natural diseases are mixed up. Intensity of symptoms may be altered. Some symptoms may be cured by the drug. Drug used is of opposite nature to his disease. It shall bring temporary relief. It is dissimilar. There will be no effect or will become more complex. Healthy person includes subjective and mental symptoms can be recorded properly. We get pure and accurate symptoms. Give response properly according to full capability of vital force. Peculiar characteristics of drug can be known. What are the qualities of human prover? The ideal prover. Ideal prover includes are those who are healthy, intelligent, delicate, irritable and sensitive, who can express the minute changes. Best prover. The healthy, unprejudiced and sensitive physician himself. Idiosyncratic prover. The idiosyncratic person is the best possible prover of the substance to which he is idiosyncratic to. Choice of the prover. The proving should be done on both sexes of all age groups and many individuals. Why both sexes? There are some diseases which are only seen in men and some in only female. Why all age groups? Because some drugs act according to the age group. And the drug action is different in different age groups. Preparation of drugs for drug proving. In case of indigenous plants, freshly expressed juice should be preferred. Exotic vegetables powder or tincture with alcohol. Salts and gums should be dissolved in water just before taking. Dry and weak medicinal substances infusion made by pouring boiling water. Next come to the doses. It is given in the aphorism 121 in Organ of Medicine. Strong medicine, milder medicine, weakest medicine. Strong medicine are those liable even in small doses to produce changes in the health even of robust persons. Milder medicine must be given in more considerable quantities. Weakest medicine proved on healthy, delicate, irritable, sensitive persons given in much large quantities. The mode of administration. Potentized medicine should be given to the brewer on empty stomach. Daily 4 to 6 globules of 30 potency moistened with little water for several days. The mode of administration is very important. Next, why only the potentized medicine should be preferred? Crude drug substances doesn't give a full idea amount of sign and symptom. By potentization, the dormant power of the drug is aroused. As the vital force is in dynamic plane, the disease which is affected to the vital force is in the dynamic plane. So the medicines should also be in the dynamic plane. By the process of potentization, we can bring the medicines to the dynamic plane so that they can act on the disease which is in the dynamic plane. Next, coming to the recording of symptoms. Symptoms to be recorded during the proving. Symptoms produced by primary action of all medicines are recorded except narcotics. In case of narcotic substances, secondary actions are to be noted. Alternating actions which are produced by some medicines are also to be noted. Modalities. They are aggravation and amelioration. In order to determine the exact characters of symptoms, the modalities are recorded. Any alteration from normal health should be recorded. By proving on sick person, symptoms which might have been observed or never before, consequently new ones belonging to the medicines should be recorded. Recording of symptoms. How to know the above symptoms? In case of literate prover, he must note down all the signs and symptoms, changes, sensations that he feels or he observes in his body should be recorded, and sufferings, accidents and changes of the health he experienced at the time after the ingestion of the drug, and the physician should look after his daily record. Next, coming to the illiterate prover. If the prover cannot write, the physician should inquire every day concerning the nature of symptoms and the manner of their appearance. The physician must note down his sensations chiefly from voluntary narration without asking any leading questions. If the physician is prover, recording will be more accurate and the prover is the best prover. Next, coming to the precautions that should be taken while proving is done. Regarding the medicines to be proved must be well known and genuine. It must be taken in perfectly simple, unadulterated form. Every medicinal substances must be taken quite alone and perfectly pure. Medicine must not be given for successive dose, as too frequent repetition confuses the symptoms. Administration of large doses should be avoided. Precautions to be taken in case of regarding the brewer. Medicinal restrictions, dietary restrictions, mental restrictions. What are the medicinal restrictions? Those substances which have any medicinal property should not be taken. Green vegetables, roots, all salads, spices, beverages are included in dietary restrictions. Mental restrictions include avoid overexertion, should have no urgent business, devote himself to careful self-observation. By this, the drug proving, we can know the knowledge of a drug. There are some other sources of acquiring the drug knowledge. They are poisonings, chemistry, biochemistry. Symptoms collected from the cases of poisonings. Example: laxasis, crotellus, arsenic. Chemistry. Chemical action of a drug can be known and active principles can be known. Next, biochemistry. Give biochemical action of drugs which deals with the sphere of action on one or two systems. Hereby this we end the video.